I have referred to my residency a number of times on different episodes of GynoCurious, but I am not sure I have ever really dove deep into one of the major challenges during that time of my life. First, I want to say I am so grateful to have had the training and developed the expertise of being an OBGYN. And certainly I had several terrific mentors during those 4 years. But there were also far too many events, whether on the labor floor, in the OR, the clinic, or exam rooms, where I had to bear witness to mostly older white male physicians treat their patients with hostility, humiliation, and sometimes what I can only say was abuse against the female body. Examples were when the obstetrician cut an episiotomy that was not necessary, when he used a large speculum on a virginal vagina, when examinations were rough and or prolonged and painful, and the doctor didn't seem to care how the patient was crying throughout the exam. I saw this far too many times. I felt so helpless and voiceless. I was dependent upon these attendings to get through my program. I was convinced if I spoke out against these men who had so much power, I'd be fired from my job. This is a part of the medical patriarchy few talk about. This is a part of the history of gynecology that is truly its shadow. Over the many years since my training, I've heard so many stories from patients about experiences of abuse veiled as gynecological care. This is not a part of my professional experience I talk much about. In fact, in preparation for this episode, I reached out to some of my peers and asked if they had the same experience as I did. Was I feeling just particularly vulnerable around this history in the face of the current political climate? Well, their stories validated mine, haunting them as well. I think we all feel ashamed at bearing witness with silence, yet knowing our professional careers may have hinged on that silence. There was no Me Too movement at that time. Yet after seeing a performance piece addressing this problem, sitting in the audience tearful and reliving the years of my training, I felt compelled to talk about this with you. We all deal with our traumas in different ways. Today, we're going to talk about this on GynoCurious. I am your host, Dr. Amy Novatt. From both sides of the speculum, we are here to investigate what it means to be a healer and to be healed. Please send your comments to comments@Radio Free Rhinecliff and leave 5 stars right now while you're listening, since this helps promote the show and assists in continued learning about our bodies and our health. My guest today is Kate Valentine. It was her one-woman show, a woman of a certain age, that inspired me to talk about this challenging topic of medicine and abuse, midlife, and the body politics. Kate is a performance artist, writer, and director. Welcome, Kate.
Amy, thank you so much. And thank you for your very powerful introduction that opens up so many topics that I'm very eager to discuss with you as a gynecologist.
Thank you for being with me today. I'm so grateful for you and your performance. So I guess why don't we start by just you're telling us a bit about yourself and your professional career.
Yeah, I'm a performing artist. I started out as a kid. I came from an artistic family, so the arts were always my form of self-expression. I was quite a shy child, and that way of communicating always really spoke to me. So I went on to go to college at NYU and then have pursued a very varied career in the arts. My performance life has included producing and performing in burlesque and cabaret. It's involved experimental dance theater, and it's involved directing original pieces of theater, a lot of one-person shows, actually. And this show that you came to see was my first personal foray into creating a one-person show.
So again, I can't speak enough, and I don't know whether it was, again, about the zeitgeist of the time, or it was just my time to really unpack what I saw as a resident. But while I was sitting in the audience, there were other people who were clearly triggered by the performance. But I quite frankly, I was tearing up throughout the story. I laughed a lot, but I also was quite triggered. which I love. I mean, that's what I love about theater and performance is that it evokes so many different emotions. But why don't we talk about A Woman of a Certain Rage and, how this piece came to you, why and when, and tell a little bit about the storyline so people understand perhaps my reaction to it.
Yeah,
Yeah.
absolutely. It's a very particular show, and it's been a very particular journey for me and quite distinct from other things that I have made. I have always, my work has leaned towards the comedic. It's definitely character based. I have not done anything of a personal nature. And this, contrary to that, is extremely, extraordinarily personal. Things that I had not shared with anyone, never mind uh, in a public space
Mm.
with an audience. But I felt extremely compelled to tell this story at this point and at this point in my life. I personally struggled with post-traumatic stress disorder. And I came to realize in my recovery from PTSD that my history of physical and sexual abuse was a piece of the reason why I developed PTSD.
Mm.
And my suppression and repression of the emotions that attended those assaults was what was keeping me unwell.
Mm.
And furthermore, it became important to me as I've reached middle age and as I've started to go through perimenopause. It has occurred to me that, again, contrary to popular belief systems, this time of a woman's life is of critical importance, not just to oneself, but I think to society at large. I think that this is a real opportunity that women have to be the wise ones, to be uninhibited, to tell their truths, and to promote a more just society at large. And I feel like it's when I started seeing things in this way, it started to feel like I had an obligation to
Mm.
tell a story because the story is not mine alone, right? If it's just my story of, a personal misfortune, then I can hold it. It's my job to fix it. It's my job to take care of it internally on a personal basis. But if this is, an epidemic, then I'm honor bound to tell the story, right?
Mm.
And if I am, uh, I am a white woman, I am what's being called cisgender, right? I'm, presenting in a in a package that's pretty acceptable by the the people who decide what's normal and what's correct, right? So if these things are happening to me, these things are happening exponentially more to people who aren't passing by whatever standards the society decides you pass, right?
Right.
So, I had been assaulted as a very young woman by a doctor, and then again by a doctor, and then again by a third doctor when I was actually delivering my child. Okay. And these things were separated in time. But once it became three incidences, I started to think, my gosh, can I really be the only one who's experiencing this? And it's so much to do with the patriarchy. It's so explicitly about abuse of power. And so my one woman show is about these incidences, about how I suppressed them, and about how I need to talk about them now, and the importance of talking about it now, I think, for the larger society.
Mm. Thank you. Thank you. Yeah, carrying, if you will, information about universalities is it's a blessing and a burden. I often talk about part of what I'm doing with GynoCurious is sharing some of the kind of universalities or universal experiences of vulva havers and trying to let people know that they're not alone, that we struggle individually and as a group, vulva havers, and that so much of what we experience is a result of the patriarchy and the power hierarchies that so many of us are exposed to from day one in our family units, in our schools, in our doctor's offices, et cetera, et cetera. So it's so interesting to me how there is something about this midlife phenomenon that I'm really trying to kind of figure out how to talk about it with women because it's full of paradoxes, isn't it?
Hmm.
It's, on one hand, it's about a time of wisdom and a kind of a generative power feeling of I don't give a fuck anymore what people think about me, coupled with all these lines and oh my vagina is dry and oh sex who wants it and kind of this shift in the body and
Right.
in the mind, and it's just this really rich experience that's got, light and shadow, good and not so good, hard and easy. And so I think that's part of what you did in your show too, is that with humor and with the sharing of your trauma, there was a way it through the midlife, because you speak to that. It was just such a wonderful, open illustration of the light and the shadow of this time in our lives.
Right. No,
So,
thank you for that. Because the show, I think probably what I didn't highlight when I was talking just now is that it is also funny. And I am a big believer that sense of humor, finding the funny in things is an a critical survival tool. I mean, it's the only real survival tool to get us through life, right?
yeah. Well, it's interesting. I was also, when I was reading about your life's work, I was struck that you've had this really creative use of your body. That's been so much a part of that career as a dancer, performer, burlesque. Does this strike you as ironic, or has it been a necessary kind of part of your healing experience after these abuse events?
No, no, absolutely. I think it's the latter. I mean,
Yeah.
I'm a person who's very much in my body and of my body. I to be able to key into nonverbal communication as a young dancer was so fundamental to me and who I was. And uh, burlesque was something that I didn't seek out, that I found by chance. But at the time that I discovered it, it was very much a feminist journey. It's absolutely about owning your own body and being able to use it as a tool of self-expression, to be able to own your own sensuality and sexuality, and having a body as a political act. Not letting society at large define who you are and what you are, right? Using it as what I believe it is. I mean, it's we're spiritual creatures having a human experience, right? This is our suit that we get to walk through this existence with, and we're charged with, using it to the best of our abilities, right? And I think that within menopause, although for sure there's a lot of weird shit going on. Weird. We could just file that all. I'm not a doctor, so I'm just going to call that weird shit.
I like that. I like
Um,
that. There's a
but
bold underline under that, Kate.
but I think that I guess my thesis within my show is that we have an immense opportunity at this time in our lives to reclaim our power and to meditate a little bit on those feelings of anger. And I think that, and not to denigrate or suggest that people shouldn't take hormone replacement therapy or people shouldn't do whatever they need to do to feel good and well, but maybe it is useful to look at that anger and how it might be utilized as a pointing in a direction where we might need or want to go, you know,
Yeah.
as an energetic force for possible positive change.
Do you think that this power that we begin to feel, the anger that certainly is percolating up, is partially a response to that we're no longer at risk for pregnancy, and that kind of enables us to put up our fists in a way that we couldn't when we felt more vulnerable to rape or unwanted pregnancy? I don't know. What do you think about that?
Oh, that's interesting. Gosh, that's interesting, Amy. I would have to
Yeah, it just
I
struck me.
I'd have to give that some more thought, but I will think about that because it's a very interesting idea, isn't it?
Yeah, because
Right.
it's not. I mean, so I could talk as a scientist and someone who understands physiology, all about estrogen and progesterone and
Yeah.
testosterone, and kind of what's happening on a cellular level during this time in our lives. But I don't know. Is it because our estrogen and progesterone levels are dropping much more than our testosterone levels, and hence we have this power and this surge of anger, and that's what propels us to feel this way? I mean,
Yeah.
I think it's
Yeah,
a
well,
very complex
for
phenomenon.
for sure, having experienced firsthand the physiological effects of being pregnant and being a parent and those urges to, caretake or that preserve the others. I mean, those are very intense physiological sensations, I mean, the fact that, your baby cries and from across the room, your milk starts to expectorate, that this real connection, the body mind connection with other creatures and the need to protect them is awesome, in the biggest sense of the word. Yeah, maybe free of that, we could take on a larger charge, right? That now we can stand in front of the herd and tend to that.
Yeah, it's curious.
Right.
So in my setting, first of all, there's science and data that shows about 1 in 4 women have experienced some kind of sexual abuse. And in my office, this is sometimes manifest as chronic pelvic pain, sleep disturbances, certainly mental illness, lots of somaticizing. Without the person knowing or being aware of that history of abuse, it's been so firmly entrenched in a place of denial, filed over by, folded into fear, et cetera, et cetera. We know this, sometimes people, it takes them decades to kind of all of a sudden know about these realities. What would you say to women out there around, you mentioned the word well, that you realized that you wanted wellness in your life, and that was part of the unpackaging of this trauma. Can we speak a little bit more about that, please?
Yeah. Boy, I love to hear you talk though. I think that what you're saying is very powerful. And I think that boy, there's so
Well,
many
let me
things.
say one more thing, because I think that maybe, and I'm hypothesizing, so please, tell me you're full of shit, Amy. One of the reasons that you are healing as you are, because I am experiencing that in your voice, in your body, in your performance, is that you've used your body not to suppress, but to express.
Right, right. Well, I think that let me try to speak about this from the personal and then expand out to the larger vision of it, if I could.
Great.
Um, for me personally, I had gotten, I think, sort of backlogged. Do you know what I mean? Like there had
Mhm.
been some traumatic things that had happened that I had suppressed or healed in my own personal way, right? Everyone finds ways to heal that might not be the best ones. And then maybe they need to revisit things and, like maybe a bone has set naturally, but it should have been broken and reset in the proper way. So it's healed, but it's kind of at an angle and you're limping, right?
Right. I would use the word rather than best, complete, or as thoroughly as one can. I mean, trauma is a weaving in all of our lives. And I like to say to women, we never forget about these experiences, but if we can find a way of making it a thread through our quilt, if you will, that just keeps things more intact as opposed to torn apart, that's our goal.
Right.
Yeah.
And I think that one critical mistake that I made was not sharing things, keeping the things to myself, having to fix things by myself. And this kind of deep, like my monkey brain told me to like hide it away for whatever reasons, which I won't delve into speculating about here. But I needed to learn the lesson that you need to feel it in order to heal it, as they say. Someone says that. So, and I needed to reach out and ask for help in order to do so. It wasn't something that I was capable of doing by myself. And then I pursued specifically for PTSD. Through a friend, it was recommended that I do EMDR. And EMDR was a modality that sounded on paper to be pretty out there to me.
Could you tell the audience what that is?
Yeah, it's a sensory processing exercise by which you sort of replay incidences in your life. And while you are talking about it, there's a series of different eye movements that you do, and it's meant to sort of reroute the way your brain is processing that information. I'm probably not doing the best job at describing how that works, but the idea is that trauma lives in your body in certain ways, and the memories of it are routed through your brain in certain ways. So in rehearsing them in a specific way with a practitioner of EMDR, you are sort of dismantling the neural pathway and healing it that way.
No, you did. That's perfect because the idea, I mean, first of all, no one really understands it, quite frankly. No one understands the brain that well. But what you're speaking to is the neuroplasticity of our brain and our capacity to reroute, alter the way those memories are held in the mind and the body.
Right. And then it's a little bit of an echo chamber with something like PTSD because your body is experiencing, you're on high alert all the time, right? And you are creating and recreating trauma in real time, I feel like. In any case, the desire to figure out a theatrical way to talk about this has been healing for me personally. But I also really think that, like what you were referencing, Amy, about how you as a doctor witness women experiencing different kinds of pains and trauma in their body that could be traced to repressed or suppressed abuse issues. I guess what I'm trying to, by talking about it, I'm hoping that I can open a larger discussion amongst people about the fact that this is so. And if we don't talk about it, if we don't heal it, we are focused on ourselves and our illnesses in our bodies. When, if we would heal it, we could reach a point where our energy could be focused on more important tasks. And that is that, to me, there is a huge power imbalance on our planet with the human race that goes beyond this election cycle. And if we are to dismantle the patriarchy, which is not just male, the patriarchy exists, as you touched on, inside of the medical industry. The women who are doctors are taught this mindset, right? So it's tricky. It's not all men are in the patriarchy, and not all women are not in the patriarchy.
Well said.
But if we are to, and we are not just male and female, right? There's more on the spectrum than that. But if we are to, I think that we really have a battle ahead of us. And we really need all hands on deck to be fully present and available to dismantle that patriarchy. It's not going to dismantle itself. It's not just a question of men stepping down. Women need to step up. And in order to do that, we have to heal this whatever has harmed us in the past, name it, heal it, and otherwise we become this hall of mirrors where we're just like, oh, my sagging skin. Oh, I need to find a cream. It's like, we don't need to find a fucking cream. We need to balance planet Earth. What?
Yes, our priorities can get a little distorted, can't they?
That's what I'm saying. I feel like we are talking about the wrong things, too much of the time.
But I also think to tap onto that is our silence. Again, talking about this today for me is not easy because I'm kind of, as much as I'm not talking about the details of what I saw and what I experienced and how that trauma has affected me, it's very deep. And I now write about it to try to excavate it and to get it out and to understand, quite frankly, all the anger I feel around it. But all of us, I think, and I say this with so much respect because it's not easy to excavate this stuff. But by our silence and our letting our fear envelop us, cover us, dismantle us, we are just, of course, perpetuating the abuse. We're perpetuating the sense of shame around it. So I think that's how I interpret you're saying we got to step up. We got to stop focusing on our creams and say out loud, as hard as it is, about these experiences, again, to make sure that people know that you're not alone. And two, to use this anger in a positive way. Anger has a place. And we've got to learn how to express it.
Yeah, it's really tricky, though. It's tricky.
Yeah.
Things are tricky. I mean, first of all, who wants to be labeled as the angry one? I want to be as fun as anyone else, And also, I just want to back up and say that I have such a huge respect for medicine and for science and for people who practice medicine. I am in awe of those people and the work that they do, by and large. So I don't want to give the impression that I am, throwing out the baby with the bathwater. There's so many people, both male and female, that are true heroes and healers, right? But it's also very tricky. I hear in your introduction, it's like for all of us, at every step of the way, it's like, at what point am I complicit? At what point do I speak up, in the scaffolds of power, right? Like, I'm just one person. I'm there. I'm trying to get my medical training. I'm being you now. I'm there. I'm trying to get my medical training. I'm doing something in the larger scheme of things that's good. Am I really supposed to step up to this person who I see doing something wrong that's in a position of power over me? What good is that going to do in the larger scheme of things? I don't know the answer to that, but it is very tricky, right?
Well, I can say, it's interesting because I think, I know what motivated me then and kept me in it, because there were many points along my 4 years of training I thought I'd quit, was I was so compelled and aware of how healing women was my life's work. And that in a way, in spite of bearing witness to this, that I knew, in a way, that allowed me to know how to do it differently. Now, I want to make sure I'm really clear about that. One doesn't need to see trauma to know how to heal. One doesn't need to see violence to know peace. But that when I hear women tell me about these stories, and it resonates so deeply with me because I saw it. I also know how important and how, for both my patient and for me, it is to be kind and respectful and honoring and healing and all that I hope I do in my office setting with women. So it's, I don't know, the lessons in our lives, they're so varied and nuanced and important. Some of them I wish I had not had, but it's an interesting, it's just an interesting inquiry about about compliance, bearing witness, speaking out, all this stuff.
Right. I mean, it's hard to understand like what can really be done. I mean, I wonder, like, I remember reading The Woman in the Body as a college student. Are you familiar with that book?
Mm-hmm.
I
Mm-hmm.
utilized an image from it because it shows it it's a book that talks about it's a sociological book that looks into uh, how women are perceived historically in a biased way.
Mm-hmm.
And some of it includes some medical history. And there's a long history of women not being studied or being studied with such a huge amount of bias that it's like absurd. And there's a photograph of an imagining of what the internal organs of what uterus and ovaries look like that looks suspiciously like male anatomy, right? Like it just looks like an inverted penis and testicles. It's comedically, I mean, I use it for comedic value in the show, but it's horrible, you know. It's horrible, and it very clearly illustrates the medical bias in that case, right? Is there a way you think from your perspective as a medical professional how that could get rooted out of modern medicine? Is it just a question of more research, or is it a question of how doctors are trained?
It's all of it. It's all about it's about, so just to point out, we didn't use female rats in research and development until the mid 1950s.
Mm.
So for so long, only studied male rats. I mean, it just is crazy. But so certainly in the world of OBGYN, more and more, if not 90% of OBGYN residents are women. As you pointed out, that doesn't mean that they are necessarily kind and supportive of their patients, but it certainly has changed the kind of overall tenor of these departments and training programs. More women who are in charge of these departments, excuse me. But in terms of global medical careers, there's still most of the departments are run by men. So bringing more equity in and diversity into the world of medicine in terms of who's practicing medicine is so important. Again, money is very powerful. So as you probably noticed, there's this whole burgeoning of conversation about the perimenopause and menopause right now. I mean, anywhere you look, there's someone who's communicating about it. And I suspect, well, I know that as a result, there are more and more big pharma studying this and trying to come up with the next best medicine, the next best Viagra, because there's money to be earned here, lots of money. So that's, again, speaking out loud moves certain tides, and it certainly moves the tides of big pharma. And I think that, the collective unconscious, which Jung speaks about or spoke about, I think, again, the more we speak out loud, the more we write about it, the more we perform about it, the more we laugh about it, the more we empower each other on a one-to-one level, that's going to change things as well. And I know that sounds a little naive, but I truly believe in that.
Yeah,
So
no,
it's all of
I don't
this.
think it sounds naive. I think it's absolutely the truth of the situation. I've experienced that as an artist. I think that, you as an artist, you really feel collective surges in different directions, right? And how energy can really start to uh manifest, to create tangible effects. So I think that for sure something is, there is a change afoot with all of this. But at the same time, just in terms of my own personal story, I speak about the doctor that delivered my child, right? He's still working. I know other women specifically directly that had negative experiences with this doctor, right? I was not the exception. I was the rule. He's still in practice, It's like in a situation like that, I tried to file some sort of a report, but it comes down to a he said, she said thing. It's very, very difficult for me to uh, be effectual in terms of stopping this person from perpetrating this on other bodies. That's my primary concern, obviously. Although
Yeah.
I have seen in the news that there's been some really groundbreaking court cases in New York against doctors recently. Do you keep up with that?
Yeah. Yeah. I mean, I think unfortunately, it might be the limiting factors are if other doctors are not saying to the administration, this guy is awful, things don't happen, and potentially a certain number of patients complaining, and I don't know what that number looks like, which is obscene. It should be one person complaining, and that should be sufficient. But it is, I mean, it's long standing, this ritual. I don't know another word, a ritual of keeping these men in their place. It's just astounding to me. And I don't, I think sometimes it's about, oh, this person is the only OBGYN in this community and there's nobody else around. So we're just going to let him do what he needs to do. Really? Or, oh, that person brings a lot of money into the hospital because he knows how to do a particular surgery nobody else knows how to do. We're just going to keep quiet.
Mm.
Or, oh, we'll fire him, but we're not going to say why we fired him. So that he goes on to the next hospital where he just perpetuates the same behavior.
Right. Well, that's what I remember about that big case that happened here, because there was a doctor, he just moved states.
That's right.
And
That's right.
That seemed like didn't impact him hardly at all, right?
Yeah. Yeah. It's yeah, it's such a problem. And it's not even just about medicine. It's about in every workplace that doesn't effectively discipline people who perpetuate abuse.
Right.
Yeah.
Is there a consortium amongst female or non-binary gynecologists? Is there some sort of organization that is like a watchdog?
Great question, and not that I know of. Not that I know of. And part of this, part of the problem is, and I'm not condoning it, I'm just maybe explaining it, I don't know, is that physicians are so busy these days and they're so challenged by the corporate medicine model. They're just trying to get through their day that, I know at the end of a work day, my peers were like, I just want to go home and put my pajamas on. The idea that I'm going to go to a meeting to fight the good fight. I mean, sometimes I think it's intentional, exhaust people.
Swear you down to the point of compliance.
Exactly. Because no one then talks about the 15-minute visits. No one talks about, I mean, I remember when I raised a conversation that the corporation I worked for, I no longer do, felt they wanted to change all the speculum into plastic speculum. We know practitioners know the plastic speculums hurt more. They create much more friction. They are terrible for the environment, et cetera, et cetera, et cetera.
Right.
I can't tell you how many deaf ears this conversation fell on. And of course, I could never even get to the person who could perhaps initiate change. It's a real problem. But you've just inspired me, though. I wonder, did any other clinician in your audience come up to you? Has anyone else come up to you after the show?
No, not yet. I've done a very limited number of performances of this, and I'm looking forward to doing more. And so interesting that you contacted me, Amy, actually, because I have been thinking about this in terms of trying to advocate, like trying to connect with feminist groups about ratifying the ERA, because I feel like that's the back route to bodily autonomy that is necessary in this current world, right? We're not going to see that improving through our judicial system, I don't think. But if we finally had equal rights in our Constitution, and it's insane that we don't, then perhaps we could use that as a way of insisting upon our own bodily autonomy. But I would be curious to I keep on using the word curious, and then I'm like GynoCurious.
Hey, man, that's
And it would be great to connect through the avenue of gynecologists, because again, this piece is in no way meant to denigrate the medical profession or imply that all doctors are evil. It's just insane that we live in a world that's so biased against female bodies. And so that's the thing I'm trying to speak to. That's what I'm trying to talk about. I think surprising to people that you could be consistently in abusive situations, in medical situations. Although I will say that quite a few people have approached me to say me too, like a medical me too.
Yeah.
And that I did not expect. I expected people to maybe open up and talk about different kinds of sexual abuse stories or trauma. But I didn't think that specifically, like, for example, a woman came up to me and she was with a group of 6 other women. And she said that after the show, they had gone out for dinner, and 5 out of 6 of them had stories about doctor's office traumas. And I was like, whoa, I didn't expect that reaction.
Yeah.
So it is something that, I guess it confirms that this is something that needs to be discussed. And so I hope that I'm looking for producers. So if anyone in your radio space is listening, I have some future shows that I can't talk about at this moment, but I'm looking for producers to help me get this show happening in a long form way in New York City. We just did a single show up in Saugerties, which you saw, and we did some trial shows last spring and early summer in Manhattan. So looking for ways to continue it and possibly tour with it.
It strikes me. I remember when Eve Ensler's The Vagina Monologues, came into the fold of our consciousness, and how that show is still performed on college campuses, and how wonderful your show would be in the college age cohort. Because part of the reason you and I are talking, I hope, again, is to let everyone out there know they're not alone, but also to try to create some strategies by which they can prevent this from happening to themselves in the future. And I'm always talking about advocacy, having the capacity and strength of character to say, stop what you're doing. I'm getting dressed. I'm leaving. Or I'm not getting undressed before I have a chance to speak to you. And I'm not going to sit in this paper gown in this freezing cold room without knowing who I'm going to speak to or who's going to examine me. Or I want a nurse in the room every single time you come even near to me, because I need to have a witness.
Right. And for sure, I speak about an incident that happened when I was a teenager, and that was not in place. Now that's a standard protocol.
Right.
That if you're in a room getting a procedure with a doctor, there's a second person there, usually, same gender, etc. So that was absolutely not in place when I was a teenager. If it had been in place, what I describe in my show, there's an incident that I describe, it would not have happened, full stop. There's no way. It wouldn't have been allowed, for
Right.
someone
Right.
who was like, who had lost it, you know what I mean? Who had like
Right.
definitively lost it.
Right.
Um, so thank God that, or whomever, that has been established. But for sure, we could go so much further into getting those kinds of situations in place.
Yeah.
And I don't know, maybe, it's just small day-to-day things. I am a, a a bulldog in terms of advocating for my children, and very mindful that I have a child with a female body, and what I need to do to make her feel strong and confident and proud of herself. It's a it's important. I mean, important doesn't even begin to describe what it is, but
And to teach our children who have penises how to be in the world respecting, supporting, speaking about sex, sexuality, gender in a way that's respectful and supportive.
Well, look, what I realized, because I always really wanted to have children. I have a assigned female at birth child and assigned male at birth child, and it's such an education to experience those two people growing, and it highlights the shortcomings in society for all human beings, the places where, people don't get to express the full spectrum of themselves, right? And there's shortcomings on all the way around that need to be balanced and corrected. But I really feel like the females of our race are the ones that need to do it. The imbalance is, this is a very male powered world that we live in. And I'm not saying get rid of all the men. I'm saying we need to balance it.
Yeah.
When the female energy is what needs to come into full effect here.
I just want to mention there was an article in the Times today about a young female identified chef who had her picture taken when she was pregnant. And the article is all about kind of pregnancy and the eroticization of it and the commoditization of it and sex and reproduction. And I like the article because it basically goes through all of this. And in the end, this young woman has just kind of said, fuck you, this is my body. I'm going to, cover my nipples with cookies, not my hands. It's a great article. So if you can read it, I recommend it.
I'll definitely check it out. I'll definitely check it out.
So I want to read something that I read, because I think as we come to a close, I just want to kind of affirm what you said about burlesque, because I didn't have much knowledge. I've seen it, but I didn't know much about its origins. And this is just one quote. Quote, burlesque is more than just a performance. It's an art form that can be empowering and subversive. It can help people reject patriarchal norms and create a more inclusive society. Burlesque is welcoming to women of all ages, shapes, and sizes, and it encourages performers to build characters and have fun. And I just thought this kind of encapsulated, in a way, your work. The short time that I've had this opportunity to speak to you, who you are, your future endeavors and wishes. So I just liked that quote.
Yeah, whose quote is it?
I don't know. It was just in the middle of like all this description about burlesque, but it didn't have any reference. So
yeah.
I couldn't find it, because I like to give credit where credit's due.
Yeah, sure. No,
Yeah.
absolutely. Absolutely. I agree with all of that. It's a format for self-ownership, right? For creating agency. And over in the world of neo-burlesque, it's expanded past women. There's men who are involved and non-binary people. It's really can be an art form of just a pure self-expression and
For everyone. That's so great. So I like to end, I guess before I kind of come to a close, I just want to ask, is there anything that you want to share with the audience that we didn't touch on that you think is important to say or reiterate?
Well, I'm really so grateful for the conversation and the dialogue. It's given me a lot to think about, and I really enjoy trying to solve these problems. I guess all I want to say is that, I hope that maybe people will follow me and follow my journey with this one woman show, Woman of a Certain Rage. I'm eager to be performing it more, both in New York City and throughout the United States. So if anyone's interested in finding out more about it or hosting it or producing it, I would be very happy to discuss that with anyone who's curious.
How do they get in touch with you? How do they get in touch with you?
My website is katevalentine.net. So there's information that can be available there. And I believe that would have my Instagram and, all the links to my other social media.
Great. And we will also attach all those things to this episode's notes. So I like to end our conversations with talking about pleasure. And pleasure comes in a lot of different forms, and it's such an individual journey. So what gives you pleasure? If you would mention one or two things. And I'm not just talking about sex. I'm talking about all those things in life that might give you joy.
Yeah. Pleasure. Pleasure is a good subject. What I love is swimming naked in the ocean.
Oh, lovely.
That gives me pleasure. It's like, I think that's I could say many things, but I'll just leave it at that, because to me, hearing the roar of the ocean and being in nature and being able to, strip off your clothes in the warm sun and jump into the water. I mean, it's calming and invigorating. It's just the perfect, makes you glad that you have a body that you get to be in for a little while.
Well, I so wish that water and the waves continue to wash over you as often as you can get there throughout your life. Thank you, Kate. I really am so grateful for this conversation today.
Thank you so much, Amy. What a pleasure.
It's my pleasure. Thank you also to my co-producers, Jen Hammoud and Maddie Rosenberg. Until our next GynoCurious episode, please stay well. Listen to your instincts and intuitions. They are the greatest of teachers, not to be ignored.